I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Christina, thank you for joining me on Here for Good today.
Thanks for having me.
So how long have you been a part of Virtua?
I've been a part of Virtua for about a year and a half now, but I've been a child life specialist for about 15 years.
What inspired you to become a child life specialist?
I was working for the American Cancer Society, and I went to a patient camp for pediatric oncology patients. And a girl I was there with, she said, I'm a child life specialist. And she began to talk about it and how we help kids cope with hospitalization and kind of eliminate the trauma that they have with medical experience.
So this wasn't a career path that you set out to do. You just kind of stumbled on it.
I first went to school for business and really wasn't finding that was my niche, but kind of, that's where life led me. And then I found this, and from the moment I heard about it, I really realized that this was something I'm very passionate about and a difference I wanted to make.
Tell me a little bit about the program.
Child life specialists help kids cope with hospitalization, like I said, and normalize hospital experiences. But besides the PEDS units here at Virtua, we also help on the ICU units, and we help kids cope with hospitalization. So while it's not just about patients that are registered at Virtua, it can also be about the adult patient and helping their children cope with what they're going through.
So you keep using the word cope, and you talk about making kids as well as the adults feel comfortable with the hospital experience. I know one of the tools that you use to support that are your, I guess for lack of a better term, theme days, right?
Yeah.
So tell me about your
Absolutely.
theme days.
A lot of kids who come here, or even when they're visiting their parents, they miss out on things at school. So while it might not seem so important or big to us for a kid to miss something like a Valentine's Day party or their Halloween party, those are big moments for children. And one of the things I started here was trying to incorporate that. So throughout my work here, I have made things like Phillies opening day. We had a whole spread of things that the Phillies organization brought to us, and we put it out for patients and families to have. We also have cookie days and Halloween parties and Valentine's Day gifts, and just those things that can make it a little bit more special.
Do you have a theme day that you're sort of partial to, or one that you look forward to every year?
I think anything that has to do with sports is kind of my favorite because I'm a huge Philly sports fan.
You have a Dallas Cowboy theme?
No, absolutely not.
Why not?
Absolutely not. I try and help with all patients and families. And if they have a love for someone like Dallas, I'd be happy to support that. But inside I might be going, I don't know about that.
Well, that's okay. I'm gonna sort of keep hope alive. I know you work a lot with our philanthropy team.
Absolutely.
To help raise funds to support some of the programs. Any particular type partnerships? You just mentioned one, but any other partnerships that have really sort of come in to support this program?
Yeah, there's lots of organizations out there that want to help support kids, and especially those in our community. So some of the ones that I've helped to bring here, the Spirit of Children Halloween has been established. And if you go to your local Halloween store, they will give money to the Child Life Department if you're buying a Halloween costume, which is a huge supporter of the Child Life Department. But also the ones I brought in are the Easter for Eli, which is a program that delivers Easter baskets to hospitals throughout the country to help make a difference. And then locally, the one major one, which is also near and dear to my heart, is the Unforgotten Haven, which I believe is in Blackwood, New Jersey.
What about some of our fellow colleagues that might want to support? Is there anything that you would want to share with your colleagues or our colleagues that might be interested in supporting the program?
One of the ways they can support us so we can support their patients and families, or all of Virtua's patients and families, is we have a child life wish list on Amazon that helps to support some of the needs that we may have to help provide books on education of things like grief or death and dying or having their sibling in the hospital and how we can get through that. So those are ways that people here at Virtua can help us.
What is it that makes you so unique and distinct to do this kind of work?
We are trained, and our background is all in psychology, family studies, human development. So, what you would tell a 5-year-old isn't necessarily what you're going to tell a 15-year-old. And so we can gear our conversations to each of them and their specific age. And also then we can help with kids who may have a neurodiversity, just trying to help them cope with what's going on. So kind of explaining what people hear, see, and feel, and going on that. So really just us trying to make a difference.
And it truly does. I want to shift gears just a little bit. I understand that the gift of life is a cause that's really, really important to you.
In 2020, my mom received a double organ transplant of a liver and a kidney. And it happened right as the pandemic was going on. 2 weeks into the world being shut down, my mom got the call that someone had, in their darkest moments, decided to donate their family members' organs. And she got that transplant.
How's your mom now?
She's doing great. She just hit 4 years. She walked with us yesterday, and it was a great turnout. And I think my thing for them is I can never thank them enough, or anyone who has anything to do with organ transplants. Making that choice in your darkest moment has to be so hard. And I've been with families when they've made those decisions. And I always say I have a unique experience because I've worked with families who are donating. I work with families waiting. And then personally, as my mom has been touched. And I can't be grateful enough.
Well, that's great. Listen, I can't thank you enough for enlightening us about what you do and your journey and how impactful not only you have been on some of our patients, but also the impact that we've been able to have on your life and your mother's life. And so those things are so, so important. So thank you so much for being here for good.
Thanks for having me.
It has been my pleasure to speak with Christina about her absolute great journey and what she does for Virtua and our community. Join in next time for another episode of Here for Good, the Inside Edition, to hear more wonderful stories.